we will create an HSS fueled ecosystem that makes the highest quality and highest value, not just the highest quality, but the highest value musculoskeletal healthcare accessible to people in a much broader geography than is accessible to us now. Yes, the nation, and yes, the globe, but that's not going to happen overnight. It's a journey that we're on.
Welcome to A&M Healthcare Industry Group's What's Your Moonshot podcast series, where world-class healthcare leaders seek to solve big problems. Listen as we talk to today's health system CEOs about the journey to achieve their moonshots.
Welcome to A&M's What's Your Moonshot podcast. My name is Stuart McLean. I'm a managing director here at Alvarez & Marsal. I'm here with my co-host, the Honorable Secretary David Shulkin, Dr. David Shulkin. David, my great honor to welcome you and, of course, Lou Shapiro to the podcast. Lou, as you well know, leads Hospital for Special Surgery right here in New York. Special surgery is the world's leading academic medical center focused on musculoskeletal health, as evidenced by the fact that special surgery has been ranked #1 in orthopedics for a dozen years in a row by U.S. News and World Report. Also been among the top ranked hospitals for both orthopedics and rheumatology for 30 consecutive years. Welcome to the podcast today, Lou. Delighted to have you.
Thanks, Stu. Glad to be here.
Lou, thanks so much for being with us. This is a particularly fun What's Your Moonshot episode for me because I'm here with two friends who I've been friends with for a while. Stuart, I think you're really good at this. You must think that you must be being the announcer for a baseball game because you've clearly practiced this before. But we really are honored to have you, Lou. Everyone knows about Hospital for Special Surgery's reputation. It's a 158-year-old organization that's really been the standout in musculoskeletal care. So if you're leading a organization like you are as the CEO of a place that's already great, what do you do? Do you just sort of rest on your laurels, or do you try to take a moonshot and make musculoskeletal care even better and improve the quality for the country? My guess is you've got some big plans ahead of you, and you have a moonshot to create a global ecosystem for musculoskeletal health. So, Lou, can you just tell us about what's on your mind and how are you gonna make musculoskeletal care even better?
Yeah, thanks, David. So this has been on my mind for 15 years, and slow to figuring out actually how to actualize a moonshot. But I came here because I knew that this place was capable of a moonshot. And over the course of the last 15 years, we've been on a journey. And I describe the journey with 3 words: better, knowledge, and scale. And you better speaks to about being better than we were yesterday. It's not really about being bigger. It's just about being better and making sure that we can demonstrate that to everyone that needs to understand that: patients, payers, employers, the government. It's the next part of our journey is about knowledge. Here we are sitting on this enterprise that's been around forever, doing one thing, doing it better in theory than anyone else, and we've acquired all this knowledge. And then the third thing is about scale. And it's not scaling our size, it's about scaling our influence and our impact. And, you know, people say oftentimes that the healthcare system is broken. That may be true. I feel that's sort of like a half glass empty statement. I'd rather say the healthcare system can be improved. We know that there's a lot of money spent on healthcare. It's not accessible by everyone. There's a lot of waste. And we know that musculoskeletal health is one of the biggest causes of disability. It's the fastest growing segment of healthcare cost. There's a lot of waste in it. And, you know, we think that just doesn't need to be the case. And we want to try to remedy that. We can't do that sitting here on the Upper East Side, even with our 20 satellites throughout the tri-state area and expanding into Florida. We need to do things differently. We need to do things the same because we don't want to screw up what we've been so hard at work at for 158 years. But at the same time, we got to leverage all the things that are intrinsic that causes our reputation. So we think we can create an ecosystem, right? And an ecosystem means bringing together pieces of a puzzle that we connect to each other with economics, with knowledge, with digital, with data to deliver the kind of care that we've come accustomed to delivering here anywhere where people are. And our priority is always the tri-state area because that's home, but our goals are the nation. And we do have aspirations and beliefs that we can extend this beyond the United States of America because we have relationships all over the world with like-minded partners. And there's 5 pieces to this puzzle that we're working to put together. 1, perpetuating the core of HSS, academic medical center, patient care, teaching, research, innovation, serving the community, the power of our physicians as being integral to what we do and making sure that none of that is commoditized. Number 2 is digital. Like everyone else, we are adapting to a digital world and are investing in digital to become more efficient, digital to better interact with those that interact with us, and digital to take care of people without them needing to get in their car and drive somewhere. And all of that with a musculoskeletal orientation. That's number 2. Number 3 is we've recently, and we should have done this sooner, we're doing it now, created what we're calling the Center for Analytics, Modeling, and Performance, where we've aggregated all of our data assets into one organizational unit rather than it be scattered through the organization. We've created a data lake and a data warehouse, and we're hiring more people who are smart about data, how to store it, how to manage it, data scientists, all of those things that you need to be able to actually use the data to not only improve what we do here, but to really, this is the real gasoline or the real fuel for the ecosystem, so that no matter where you are, whether you're a provider or an employer or a payer or a consumer, that you can have access to this data once we get it in the form we need and export it, where the same level of care can be provided there. The 4th thing, which is hard, how do we create a network? Not everything can be done digitally, and we can't be everywhere. So we need to find like-minded partners who are capable and competent at a high level, professionals that people can access care from without them getting on a plane and coming here. We're talking about physical therapists, we're talking about physiatrists, we're talking about orthopedic surgeons, and creating that network. Side note, we have an alumni program of people who were trained here that is as strong and robust as what you would see in a university, where someone spent 4 years learning and are part of their network across the country. And then 5th, and very important, is we cannot do this alone. And we have no intention of doing this alone. We need partners, and partners of different shapes and sizes to join us who want to make a contribution to solving the improvement mandate for musculoskeletal healthcare, understand HSS in our value proposition, and we can create a win-win structure where they are helping us and we are helping them with a common set of goals. And we're slowly but surely putting these pieces together where we will create an HSS fueled ecosystem that makes the highest quality and highest value, not just the highest quality, but the highest value musculoskeletal healthcare accessible to people in a much broader geography than is accessible to us now. Yes, the nation, and yes, the globe, but that's not going to happen overnight. It's a journey that we're on.
Lou, really a bold vision that you are articulating, and on a very successful platform. So I'm curious, when you've identified how important it is to continue to do what you do well, even as you pursue this bolder vision, increasing your influence regionally, nationally, internationally. How do you think about it in terms of actually staffing it and supporting it and resourcing it and measuring it? What does that really look like from a sort of a tactical perspective as you start to pursue this?
So Stu, this is really hard stuff, right? I mean, there's, large, thick books that have been written on how incumbent leaders contribute to industry disruption, right? I'm sure you've read it many times. So there's no easy solution to this. So the first thing that's critical is protecting the core. Because if we don't protect the core, then none of the other exciting things and opportunities really matter. And protecting the core is about culture. And culture is multidimensional, and it's about talent, because there's nothing to make up for not attracting the best and brightest. And actually, saying that is one thing. Doing it consistently is another. And if you sacrifice on that, game over. So protect the core. And then, there's things that we're really good at. There's things that we could be better at, and there's things that we're not really good at, and there's things that we'll never be good at. So how do we develop relationships where we can fill in the pieces of the puzzle? What we want to do is very capital intensive, and while we're financially healthy, we have a solid balance sheet. We're A plus stable, A1 stable by the rating agencies. We're in pretty good shape, but we're not a bank. We don't have billions of dollars to spend on this. So we need to find partners who want to do this with us. That could be venture capital, that could be private equity, that could be other like-minded organizations that don't fit into the financial services category that want to work with us. I won't mention names. They could be providers, they could be insurers, they could be technology companies. There's no shortage of people and organizations out there that don't understand the dilemma and the opportunity as it relates to musculoskeletal healthcare, and would probably find a relationship useful. I know they would, because we have, there's not a day that goes by where we're not talking to someone about something. We measure everything that's important. We measure our value proposition to employers, to payers, to consumers, everything, and to our internal customers. We measure our culture. As an aside, our NPS is 96. That's unheard of in healthcare, unheard of. So we measure everything. So, as we develop a relationship with employer, are we getting people back to work sooner? Are we saving them money over the course of an episode of care? Are they more productive? Are they happy with the services we provide? Are people getting back to their activities, whether it's walking or running or playing golf or, whatever it is? So no, whatever it is that we're doing and whoever we're doing it on behalf of, making sure that we have those measurements in place, and those will evolve. Those will evolve over time as we continue to grow and develop.
Great. Well, Lou, if you could help my golf game, I'd appreciate it because I really don't play very well. But
yeah, I'm with you. I don't have I did ask one of our upper extremity surgeons if they could fix my golf game, and they said no.
But that would be a business I'd invest in if you could figure that out.
But David, we can figure out how you move, and how you move contributes to how musculoskeletal healthy you are and where you are prone to injury. And you could go here and go through simulations, whether it's running, golfing, or any kind of physical activity, to make sure that you're doing it well. I went through an exercise here for something that we are thinking about commercializing in the retail space that demonstrated that I had left-sided weakness. And now I understand why sometimes I get injured when I'm doing certain things. And now I have a regimen that if I followed, would address that. That's real stuff. And theoretically, that could improve your golf game or improve whatever it is that you do.
No, absolutely. I think part of your vision, which I love, is the prevention and
health,
and really the health and wellness.
Healthcare is two different words that mean two different things: health and care.
So let's go back to, I know you have a vision for 2030, the world of musculoskeletal care, which is unbelievably maybe only 8 years away. But you want to protect the core. Now, when I got together with you not too long ago in your office off of First Avenue, you have some pretty big buildings filled with people getting surgeries and requiring hospital rooms. So isn't it inevitable that care is going to move out of hospitals into the ambulatory setting? Or do you see a different vision for the future of musculoskeletal care? In other words, how do you put your moonshot into play and still protect your organization that's largely hospital based?
Great question. So the moonshot is sharing what we've done here with others in a very sort of direct way, so more people can benefit from it. Number one. Number two, we have the privilege of being in the one of the most amazing geographies in the world. So there's a lot of people that live in New York City, even in this phase of pandemic that we are in. There's still plenty of people who want to come here for care. Number three, absolutely, things are shifting to outpatient. They've been shifting to outpatient as long as you and I have been in this business. I remember when I started 38 years ago, whatever it was then was an inpatient, and then a few years out, it's just continuing. It's not new. It's just continuing. Maybe it's accelerating, but it's just continuing. And that's why, not really part of the moonshot, but part of the core, we're building our delivery system throughout the tri-state area. We have 3 ambulatory surgery centers throughout the tri-state area, and over time we'll have more, just like everyone else does. It's not rocket science. And what we're doing now is that is contributing to the ability to modernize our main campus. So as we move stuff out of here into the community, so it's closer to where people live and work and readily accessible at the same quality, with the same culture, with the same outcomes, then that allows us to make the main campus a friendlier environment. In fact, we're breaking ground in 3 weeks on a new building that is being built over the FDR Drive next to the East River, because we need to move to more private rooms, because we still have semi-private rooms, and we still need more operating rooms on the main campus, even with all of these other things going on because people want to come here because they know that they're getting a level of value that's not to say there's not great places everywhere, but they're getting a level of value. So the demand for our services is not going away anytime soon.
Good. Lou, let me ask you another question about your 5 components of your plan, of your moonshot. One of them had to do with digital care. And I want to make sure I understand what your vision for digital care is. Is that essentially virtualizing your services, or do you think that people are going to have digital therapeutics where they can actually, manage their care and do decision making off of app-based care, or are you thinking about this in a different way? And I did have a chance to see at one of the conferences, one of the companies that I think that you've sponsored or that you're invested in, where you're doing digital virtual physical therapy. So do you want to just talk about this vision?
Yeah. I think the sky's the limit on it. So to a certain extent, things that we'll do, we haven't thought of yet. So, obviously, telemedicine is rudimentary and is just table stakes. Telemedicine that's organized in a purpose-built platform, not just us doing a consult here, that is musculoskeletal oriented, where we can provide real feedback to the clinician so they can help you. How we scale that across the country, because there's a lot of PT that there's a lot of opportunities for us, because a core competency that we have that I think is at a extraordinary level is rehabilitation related, and that could be prevention, that could be post problem or post surgical, and then there's the whole world of sensors that provide feedback from a patient to a provider that allows them to provide more insight that then can be done, even if it was in person, but that's digital. And then, how do we take all of our data that comes from all of our registries and all of our technologies and help others who don't have the benefit of being at HSS and don't have the benefit of doing the same thing over and over again every day in a super subspecialized way, and take that data and turn it into knowledge that can be transmitted to others, so that there's digital solutions for us to scale what we do without necessarily scaling our bricks and mortar or scaling our talent. And digital therapeutics is probably in there somewhere. So I know that you have this problem. Obviously, if you need surgery, we're not doing that digitally. I mean, that's going to happen. You're going to have to come here or go somewhere for it. But getting more and more insight to help individuals take care of themselves or help other people take care of the individuals without us being in the middle, but us fueling that from our knowledge that resides in our data that gets converted into digital applications that can be used to perpetuate that.
Right.
Does that make sense?
It does. So Stu, I think we're getting to the 8th inning. You take over.
Exactly. So the 5 pieces of the puzzle, David talked about the digital pieces, and you talked about partnership. So the distinction between a partner and perhaps a predator or a competitor is I would think a very sort of tricky element of executing on your strategy. There are so many out there interested in disrupting this very large space, the musculoskeletal market. How do you navigate that minefield, Lou? Partner, predator, competitor? What does that
Yeah,
look
I
like?
mean, the challenge is who shares our values, and that includes um, a commitment to the same kind of thing that we're committed to, doing it in the same kind of way that we want to do it. And can we develop a relationship where it's win-win, win-win? And sometimes you can, sometimes you can't. When you can't, it doesn't mean that they're predators. It means that they just think about things differently, or they're in a different phase in their development, too early, too late. We want something that they don't want to give us, or vice versa. And there's a lot of heavy lifting, but when you partner with someone, you need to measure 2 or 3 times before you consummate that relationship, because it doesn't have to be long term. You could have exit strategies for some of these things, but you maximize the likelihood of getting that right, so you can have a long term relationship. The more people out there experimenting with how to improve the healthcare system, the better off we all will be. And not everyone's going to be successful. Hopefully, more people will be successful than will fail. And hopefully, there won't be a lot of waste in the process of time and money. The advantage that we have is we have a brand that means something. We have a history that is long and consistent, and we're not going to take our eye off the core as we do these things. So we're a little bit of a tried and true, tested partner, and we'll continue down that pathway and exploring relationships that make sense to help us extend what we're doing. And we have many examples of that. We formed a relationship with a PE-backed PT company, and I occasionally am out and about outside the tri-state area, and I'll drive by somewhere, and there's a facility that has the HSS blue logo on it, and that if you go in that facility, you'll feel the HSS culture. It's infused with our knowledge, and it's a great piece of the puzzle. And that's we found a partner who was interested in doing something in PT, and we wanted to work together, and we found the pathway to do that, and so far so good. And we probably have a dozen examples like that in services and technology, and we'll continue to advance that.
I love the kind of confident, principled, sort of experience-based approach that you're taking to partnership. Lou, as a firm, Alvarez and Marsal, we work with industry leaders across the full spectrum of healthcare, and I must tell you that from my personal perspective, it just creates wonderful optimism in me to see such a storied, successful institution. And I've been in New York for a long time. Storied, successful institution like yours, pursuing ambition, pursuing innovation, just so ambitiously and aggressively. We look forward to seeing just how that evolution in innovation evolves. So thank you.
Me too. Thank you.
Alvarez and Marsal. Leadership, action, results.
So I was just going to ask you, just because I've been staring at the picture behind your head now for so long, what is that picture behind you? Have you seen this?
Yes. So there are a bunch of Greek philosophers that believe in Stoicism, and there's a lot of inspiration that you can get from that. This particular one says the obstacle is the way.
Ah, how great.
Yeah. So I Next to the box that I have a bunch of coins in, including yours, Mr. Secretary. In front of it, I have a bunch of these coins that have a meaning to them that sometimes I carry around to draw inspiration from. And this one is one of those. And all we have is obstacles in front of us, and what we just have to do is see that sometimes provides the pathway to success as opposed to obstructing it.
I think that should be the motto of healthcare. The obstacle is the problem.
Yeah, look it up. Stoic philosophy and these coins. I should have given you one when you were
Okay,
here.
thanks.
Right next to yours, which is my favorite.
As long as I'm not the obstacle. So, all right. Well, listen, thanks so much, Lou. Really appreciate it.